and you suffer with your child so. How can they be so cruel? How can they be so cruel? That's not the America we know and love. Americans under the age of 26 can't stay on their parents' health insurance. The prescription donut hole in Medicare is reopened. Seniors are going to pay more. Essential health benefits would be gone. You'd think the Republican Party would learn. This hurt them in the election. This issue was far more trenchant than any immigration issue. And yet, they persist because of the special interests behind them. So, bottom line, we Democrats believe the ruling is based on faulty premises. We don't think it'll be upheld by a higher court. It's being appealed. The Trump administration has shamefully refused to defend these millions and millions of Americans in court. They're arguing that protections for pre-existing conditions could be struck down. And so, what is our prescription? It's the resolution led by Senators Manchin and Rosen. It allows the Senate to speak in defense of the law that we passed. We know why we passed it. We know what the interpretation is better than anybody else. And the Democratic House passed a similar resolution last week. All the Republicans who campaigned on protecting pre-existing conditions and haven't signed on to the Manchin letter are hypocritical. Totally hypocritical. You don't talk about wanting to protect it and then not do it when there's an obvious way to do it. Senate Democrats are not going to let this issue go away. We're going to try to force Republicans to vote, even if they refuse to join us on this resolution, and they will have to go on record. Are they for protecting Americans with pre-existing conditions, or are they not? Senator Murray.
Well, thank you very much, Senator Schumer, and to everyone back here, especially Senator Manchin and Senator Rosen, for their leadership on this. You know, for a long time, Republicans have been very determined to make health care discussion in this country about scoring political points against a law they just are determined to hate. But at the end of the day, this is about patients and families, and right now, for what it feels like the millionth time, people are really worried. Again, young adults coming out of college don't know for sure whether they're going to be able to stay on their parents' health care plan. Tens of millions of people with pre-existing conditions are frightened that they're going to be priced out of coverage or denied altogether. Women who are wondering whether they'll have to budget extra for birth control on top of the rest of their insurance, and families who are struggling to afford the premiums they are so worried about today, that this chaos that the Republicans continue to create will cause their health care costs to go up again and again. And I could go on. But now, as Senator Manchin said, Republicans made a lot of promises leading up to the November about how they do care for protections for pre-existing conditions and about helping our families afford coverage. But all of that is now at stake in this blatantly partisan lawsuit which President Trump has thrown his support behind. So, again, if there are any Republicans who truly meant what they said during campaign season, they can show us now. The House has already taken action to defend the health care protections against people across the country that rely on it. Now, Senate Republicans, we're asking them to set the harmful politics aside, do the same, and join us on this resolution so that we can assure the people we represent that their health care coverage will be there for them when they need it. Senator Wyden.
Thank you, Senator Murray, and I'm very pleased to be joining the Manchin-Rosen resolution, which ensures that Senate Democrats are pushing back against one of the most absurd legal rulings of the 21st century. And my colleagues have said it very well with respect to pre-existing conditions. Should the administration prevail, what happens in America is the country goes back to the days when health care was for the healthy and the wealthy. That's what you have if you allow discrimination against those with pre-existing conditions. So that alone is an important reason why we're here with Senator Rosen and with Senator Manchin. I just want to mention one other point before we wrap up. Should the administration prevail on this case, what would happen in America is you would see shredding of key pieces of America's social safety net that Americans count on today as a guarantee. For example, in this decision, pharma would be a big winner if the administration would prevail. In the Finance Committee, we deal with Medicare Part D. 10 million seniors will pay more for their prescriptions if the donut hole is reopened. That's not just one way pharma would benefit. Cost sharing for seniors would go up. Pharma would get a $25 billion tax gift due to the repeal of what's known as the pharma fee. Seniors' Medicare Part B premiums would go up. Pharma would be able to charge Medicaid more for medicine, again threatening the health of the vulnerable. And seniors would lose out on a free doctor visit, which is especially important because now with the chronic care breakthrough of last Congress, showing that Medicare is not just about acute illness, it's about chronic care, we got to do more in terms of prevention. So this is in addition to the consequences that have already been spelled out, and it is fair to say, should this decision prevail, we're turning back the clock. And by the way, just yesterday, you heard Americans say, what's going to happen to who calculates our premiums and our benefits as part of the sign-up process for the Affordable Care Act when there aren't people at the IRS. So thank you, Senator Manchin, Senator Rosen, for your good work, and we're all going to be in this fight together.
Anybody have any questions?
Senator Wyden, I just wanted to follow up on what you were saying about the special effects on the advanced premium tax credit and the letter that you all sent yesterday. Is it your expectation that if the government is still shut down, that those won't be going out, or are you just, trying to get confirmation that they will continue to go out?
At this point, there's virtually nobody home at the IRS. And the IRS plays this key role in terms of trying to address the eligibility of Americans of modest means for the assistance, trying to help work through the decision about whether someone is underpaid or overpaid. And all of these key functions for millions of vulnerable people are now in a kind of self-inflicted limbo. And a lot of people are going to get hurt. That's what we're trying to emphasize today. That's what the Manchin-Rosen resolution is all about. That's what Senator Murray and I deal with on our two committees. And there is no question with respect to the IRS. I mean, people just keep gesundheit. People keep calling us and saying nobody's there to answer the phone.
Yes.
What's the strategy to get this on the floor? You guys don't control the agenda. How you guys going to get a vote on it?
Well, Leader McConnell keeps saying that basically Democrats want to shut down the Senate. This is a way to open it up, Mr. Leader. Bring this one up. We'll all vote. So we just got to keep the pressure on. They have to understand this is really do or die for an awful lot of people. They're getting the same pressure too. They're just not paying attention to it.
Is there any piece of legislation you would like to attach this to that coming down the pike? I mean, is there anything in society?
Is there anything coming down the pike? And we vote on the same thing, what, 4 times now? I don't know. We have to ask Leader Schumer what they're working on, but McConnell doesn't seem to be moving at all. I assumed during the whole shutdown we'd be voting on the same bill that we've been voting on. I don't see anything changing.
Why not instead bring up a bill that would reiterate that the mandate was not intended to necessarily be detached from the pre-existing?
I think the courts are going to be doing that. That's the whole court fight. That's why we want to intervene. We definitely have said this. The bill, I mean, if that was their intent to get rid of pre-existing condition, just because they got rid of the fee, if you will, or the fine or the penalty, then they would have put that in the wording. They didn't, because it wasn't their intent, or they knew they couldn't pass it.
Wouldn't it help to invalidate a lot of what's going on in the courts if Congress just reiterated that this was its intention all along?
Yeah, well, if
We
we
do that, but
Go
the
ahead.
thing is that what we right now want to do is to defend the bill in court so that it doesn't get overturned. That's the most immediate and most impactful.
Unrelated, kind of related topic. On the government shutdown, does this bipartisan group, is there any realistic chances of reaching an agreement? And also, would this group support adding protections for TPS people into this bill?
First of all, what we're talking about is on the ACA, the Texas versus U.S. I'm happy to talk about the other two. But what we're fighting for right now is we've got a vulnerable population base right now that's hanging, not knowing. Right now, the exchange, Ron and I were talking about what's happening with the exchanges right now and the uncertainty there and the people in limbo. This is ridiculous, and all we have to do, let us intervene. Let us show the intent of what the legislation is, defend the law that we have in front of us. We all swear an oath. Patty and I were talking. I think we all took the same oath to uphold and swear the Constitution. And let's just do our job. As far as on what you're talking about, there's a group, everybody's talking. Everybody wants to find a way out of this. Last night, I can just tell you, when they walked out, I think unanimously everybody said, let's get back, let's open up government, let's basically talk about our differences. Never in our life, never in my political life have I ever seen the workers and the citizens that are dependent upon the services be used as a pawn, and the leverage is being held against them when it has nothing to do. We agree on 6 bills. Let those 6 bills go. Mitch McConnell, do your job. Your job basically is the First Amendment of the Constitution is Article 1 is basically for us to have equal powers. Let's do it. And then let's have the debate that we need. Let's have security and the border being talked about in a civil way, not holding the country hostage.
Should TPS be part of these negotiations with the White House?
Anything can be part of the negotiations. The whole thing, we voted, most all of us have voted in 2013 in the Senate on a major reform. We wouldn't even be here talking about it. If the president would just put that up, it cures all the problems. Any other health care questions?
Thank you all.
Thank you.